Hello, my name is Aisa Calzado,
And my name is Hector Torres.
and we're going to be discussing developmental delay. So this is characterized by a delay in the normal milestones that develop during infancy or early childhood. They can be by factors that are physiological, environmental, or social factors.
Usually this certain pathology is usually between the ages of 0 and 8. So when we went to the clinic a couple days ago, we had two patients. One was 6 years old and one was 8 year old. Both of them had developmental delay. So as you can tell, they were kind of not where they should be as far as their development for their age. So that is what we will be presenting on, seeing how they are, what type of factors can help improve that, and certain things that will help them progress to help reduce that developmental delay as much as possible.
During our visit, we worked with two of the patients that fall under the 5 to 8 year old category. So some normal motor developments that should fall under this category are that the patient should be able to jump forwards and sideways, jump over 6 to 8 inch objects, skips, gallops, bounces large balls, and jumps. And some fine motor skills should be that they should be able to draw letters, shapes, and numbers, place small pegs in pegboard, print well, buttons, and small buttons.
So when I'm going to talk about one particular patient. When this first patient first came into the clinic, he was very shy, very timid. He liked to be kind of to himself. He didn't like to be around a lot of people. He's very particular on who he was with. This is the information that I got from the PTA. Also, he had very bad dexterity, very bad coordination, very bad agility, and he could barely do any push-ups. His strength was very, very low. So some outcomes that are expected from treatment are increased everything. So for example, when we first saw this patient, he could barely do 6 push-ups. When we got there, he got 10 push-ups and actually set a personal record for his max push-ups. So after all that developmental delay, all the motor delay was greatly improved with therapy from when we went, comparing it from baseline. So the amount of things, the expected outcomes for this particular patient are extremely high. All we need to do is just continue to provide that treatment, and he should continue to improve his function. For these patients, there's no specific treatment approach. Every individual is different, so we have to treat them as such. One of the big things that they say is early intervention. That's a huge thing for these patients. So the sooner we can start working on their developmental delay, the better their progress is. So one of the big things that I've seen, and was even for our patient, is balance. He had clubfoot, so we had to work on his balance and get him that coordination. And that's a huge intervention that they try to stress on, is increase their strength so that their balance is better. And balance is a huge thing that we focus on for these developmental delay patients. The expected outcomes for this particular patient seem very, very well. With just a little bit amount of time that he's been going to therapy, he's improved so much. Like I stated before, he's increased his strength, his balance, his coordination, his social skills. All of that has improved so much from his initial coming to therapy. So I believe that his expected outcomes should be really, really well. For developmental delay, it all depends on the particular patient. And like I said, the earlier you can get them to therapy, the better their progress will be. So their expected outcomes depends on how well the home exercise program is, how well the parents are pushing that therapy, and how much are they participating in therapy.
So other treatment interventions that can be used with patients with developmental delays are a patient can use an orthotic depending on the level of abnormality they have. For example, with our patient, one of our patients, she could have used an ankle
For arthroplasty?
ankle foot orthosis, which is an AFO. That would have helped her a lot. Other important interventions to consider are patient education as well as family involvement, especially with parents. It is crucial that they keep up with the home exercise program and that they're always behind their child, supporting them and trying to work with them as much as possible. It's important that the parents get involved or communicate well, not only with the PT but with the PTA as well, just to know how the home exercise program works and what type of how they can help their child have a successful outcome with physical therapy. So basically, as a reflective statement, I would say that I have truly enjoyed this experience. It was a lot of fun. Play therapy is very exciting. I believe you have to be very creative and you have to have high energy to be able to work with this population. I personally, like I did mention, I did enjoy it, but I prefer working with other. For example, with me, I think I would do better in a geriatric type of therapy.
So from my experience, I personally really enjoyed going out and looking at these patients. I love working with kids. I love kids in general. So being able to use my job and work with kids is something that I actually would really am considering. It does take a lot of energy. It does take a lot of patience, but that's okay. It teaches us better skills as a human being to help in everyday life. I really enjoyed it. I loved working with these two individuals. It was really fun. I really enjoyed my day. Time went by so fast, and honestly, I think it's something that I might want to consider as a future for me, as far as what facility I want to go to and work.
This has been our presentation on developmental delay.
And thank you so much for taking the time out of your day to watch this.